You know that feeling? You're lying in bed, you are desperate for sleep, but you get this overwhelming, almost maddening urge to just move your legs? Well, that's a real thing. It's a common but really misunderstood condition called restless leg syndrome, or RLS. So today, we're going to break down this neurological disorder from its totally bizarre symptoms to the very latest and most effective treatments. All right, let's dive in. Soda bubbling in veins. I mean, just imagine trying to explain that feeling to someone. For years, this is what patients have had to do struggle to put this sensation into words. And that description is just one of many strange, unsettling ways people have tried to capture it. We're not talking about a simple cramp or a muscle ache. This is something else entirely.
And that's really the core question, isn't it? Because this isn't some rare medical curiosity. This bizarre, hard to describe feeling disrupts the sleep and, frankly, the lives of millions of people every single night. So, what on earth is it? And what is really going on inside the body?
Okay, so let's start by defining what we're actually talking about here. This first part is all about that unshakable urge to move, which is the absolute hallmark of RLS. The scale of this problem is, well, it's kind of staggering. That number you see, 3%, that's the portion of US adults who have RLS that's clinically significant. Now, what that means is their symptoms are moderate to severe, and they happen at least twice a week. So we're talking about millions of people whose quality of life is being seriously impacted by this. And this list, it just really drives home how hard it is to describe RLS. I mean, look at these phrases: ants crawling, creepy crawly, and electric current. It turns out about 88% of patients agree on the word restless, but the actual sensation can feel so different from person to person. And this variety is one of the big reasons the condition so often goes undiagnosed. So, with all these wild and varied descriptions, how do doctors actually manage to give this feeling an official name? Well, that's what we'll get into next, how it's formally diagnosed. Well, clinicians have a really simple but powerful checklist they use, and you can remember it with the acronym URGED. The U is for an urge to move. R means it gets worse at rest. G is because it gets better with movement. E is for its evening or nighttime predominance. And that last D is absolutely crucial. The symptoms can't be explained by a different diagnosis. And here are those same criteria, just in a more formal clinical layout. You can see how they line up perfectly with our URG checklist. There's the urge to move. It's worsened by just sitting or lying down. It's temporarily relieved by walking or stretching, and it mainly happens at night. When a patient's story checks all of these boxes, a doctor can make the diagnosis. So now that we know what RLS is, the next big question is why? Why does this happen? Let's get into the science of it and explore this really fascinating connection between the brain, our genes, and a surprisingly common mineral. You know, researchers don't think RLS is caused by just one single thing. It's more of a combination of factors. First, there's a really strong genetic link. About half of all patients actually have a family history of it. Second, there's an issue with brain chemistry, specifically with our dopamine pathways. And third, and this is a really critical piece of the puzzle, there's often a problem with low iron levels. And not necessarily in the blood, but deep inside the brain itself. All right, this brings us to what's probably the most important part of this whole explainer. How do you find relief? The great news is that the science we just talked about has led to some major breakthroughs in how RLS is treated today. This is the question that really matters for anyone who's suffering from this. We need to forget the outdated advice. What do the current evidence-based guidelines actually recommend for managing these incredibly disruptive symptoms? The foundation of modern RLS management, it starts with two simple but absolutely critical steps. First, get your iron levels checked. A doctor will look specifically at your iron stores using tests called serum ferritin and transferrin saturation. The second step is to go through all your current medications, because some really common drugs, we're talking certain antidepressants, anti-nausea meds, and even over-the-counter antihistamines like Benadryl, can actually make RLS symptoms a whole lot worse. Now this is a big one. For people who need to be on daily medication, there has been a major shift in the treatment strategy. For years, the go-to drugs were what are called dopamine agonists. And yeah, they worked at first, but they came with a really serious long-term risk. So the new recommended first-line therapy is a class of drugs called gabapentinoids. They're just as effective, but they don't have those serious long-term risks, which makes them a much, much safer option. So what was that serious risk with the old drugs? It's a phenomenon called augmentation. This number, 7 to 10%, that was the annual risk that the medication would paradoxically make the RLS symptoms worse over time. The urge would start earlier in the day, it would get more severe, and it could even spread to the arms. This is the key reason the treatment guidelines changed.
So the crucial point is this. If those iron tests we talked about come back low, the very first step is to get those levels up. This can be done with simple oral supplements or, in some cases, with an IV infusion of iron to quickly boost the iron that's available to the brain.
Okay, so what if your iron levels are normal, but you still need daily medication? Well, this is where the new go-to options come in. The gabapentinoids. These drugs basically calm down the nerve signals that are causing those awful sensations, and they do it without that dangerous risk of making the symptoms worse down the road. All right, in our final section, we're going to see exactly why getting RLS diagnosed and properly treated is so incredibly important. This condition is about so much more than just uncomfortable legs. It has serious system-wide impacts on a person's health. Just take a look at this chart. It clearly shows the increased health burdens for people with RLS. Compared to those without it, they have a significantly higher prevalence of cardiovascular disease. We're talking nearly 30% versus under 20. They also suffer from much, much higher rates of depression. These are not small differences, and they're likely tied to the chronic sleep deprivation and stress that RLS causes, year after year. And this slide, it paints the full and frankly troubling picture. The sleep disruption and the physiological stress from RLS are linked to a whole host of other serious health risks. We see increased rates of hypertension, heart disease, depression, and anxiety disorders. And most troublingly, studies show RLS is associated with a more than twofold increase in the risk of suicidal ideation and self-harm. So, after looking at all of this, the takeaway is just, it's undeniable. Restless leg syndrome is not a minor annoyance. It is not just fidgety legs. It is a serious neurological disorder with significant, real-world consequences for a person's mental and physical health. And it absolutely deserves to be treated that way. And that leaves us with one last, really important question. Given that RLS is still so widely underdiagnosed, and that we now have a clear, effective, and safe path for treatment that starts with simple iron tests, just how many millions of people are out there needlessly losing sleep and risking their health over a condition that is absolutely treatable?